A number of injustices threaten reproductive autonomy in the United States. The RJ MedEd project aims to address current injustices by incorporating a reproductive justice curriculum into medical education. We have asked advocates to share their expertise in the reproductive justice movement, how it can be applied to medicine and patient care.
I'm Loretta Ross. I live in Atlanta, Georgia, and I'm one of the 12 women who co created the concept of reproductive justice. And I've been a feminist activist for the past 45 years.
Why should physicians have training in reproductive justice?
I think reproductive justice training is very important for physicians so that we can have a real impact on how patient care is delivered through a human rights framework, through a human rights lens. And it really does start with respecting the human rights of the physicians so that they can then respect the human rights of the patient.
What about other health professionals, like nurses and midwives?
I think all health professionals would benefit from reproductive justice training because healthcare, of course, is provided along a continuum. There are many people who intersect and affect a patient's care. And so everybody needs a value system that is humane, that centers the patient's needs, but at the same time doesn't neglect their own needs.
What's the difference between reproductive rights, reproductive health, and reproductive justice?
Most people who encounter the concept of reproductive justice don't understand the difference between the reproductive health framework, the reproductive rights framework, and the reproductive justice framework. Reproductive health is individual care delivery. You treat people for their illnesses or help them stay well. It is a provider centric framework. Reproductive rights is an advocacy framework. That's where we fight to access health care and to protect it through the courts, through the legislature. We advocate for reproductive health care. And most of us on the reproductive health and the reproductive rights side work together to make sure that people's reproductive options are always available to them, including seeing abortion care as reproductive health care and a part of a person's reproductive rights. Reproductive justice, on the other hand, is an organizing framework that works in tandem with the reproductive rights movement and the reproductive health movement. And we believe in the reproductive justice movement that every human being has a human right to have the children that they want to have, to not have the children that they don't want to have, but most importantly, to parent the children that they have in safe and healthy environments. And so the three frameworks work together to form what we call the reproductive human rights movement.
How does reproductive justice transcend abortion?
Reproductive justice is not just about abortion because the framework also includes the right to have children and to parent the children. And a lot of people make that mistake thinking that we're only talking about abortion, which is kind of strange because if you look at the data, most people who have abortions already have children. So it's not an anti parenting framework to even only talk about abortion. But no, reproductive justice is much broader because we want to protect the right to have children, to prevent unnecessary sterilizations or cesarean sections and things like that, so that one's reproductive choices and options and birth plans are protected. But also, once you have the child, reproductive justice is concerned with access to food, healthcare, education, freedom from gun violence, which is very pertinent right now. So we are much bigger than just talking about the right to abortion.
How might reproductive justice training help physicians understand patients' circumstances?
One of the things that we try to help physicians and providers realize when talking to a patient is that the patient walks into the clinic or the office carrying a lot of issues, like whether or not they have transportation to get to their health care, whether or not they're in a home free of violence or that has violence in it, or lack of child care, lack of employment opportunities. All of these things affect whether or not a patient can successfully follow a physician's routine, a regimen that they want them to do. And the more we can train physicians and understand the complicated ways patients present themselves, using the concept of intersectionality, that we need to understand that all of these things are interconnected in a patient's life, I think the more quality, high quality healthcare will be provided, because the patient will be seen as a whole person instead of just an array of symptoms being presented to a physician.
How can providers be advocates for reproductive justice in their practice?
Well, if physicians can't do the advocacy work themselves, they can also make sure that their clinics are sites for education and information. The brochures you have laying around, the information you have around. I haven't been in my physician's office for years that didn't have a television screen in it telling me health information. And you can also use that screen to tell advocacy information pertinent to the patient and that they know. So you don't have to be on the front lines to do advocacy. You can do it in a more supportive way. Also, we've had physicians come to state legislatures and testify when a particular bill has an impact on their patient care and their medical ethics. And so it's not always, but that physician's voice is so powerful when they become an advocate on behalf of the healthcare system that can never be overstated.